I'm Brittany.
And I'm Logan, and our presentation is on cerebral palsy.
So, cerebral palsy is the most common motor disability in children. It is caused by an abnormal brain development that usually is developed before birth, and it affects the motor cortex. So the motor cortex is directly involved in the muscle movement. It can range in severity from a slightly abnormal gait while walking to a person needing special equipment to walk, such as a walker, crutches, or anything else. And it can go as severe as not being able to walk at all and needing lifelong assistance. The disease itself does not progress over time or get worse. However, the disease can manifest in different symptoms throughout a person's life. So there are many possible causes for the development of cerebral palsy, such as a gene mutation that can lead to the abnormal development, maternal infections while the child is still in the womb, a fetal stroke, which causes a disruption of blood supply to the brain, brain bleeding, infections which cause the inflammation in or around the brain, traumatic head injury that could be due to a fall while they were an infant, or a lack of oxygen to the brain that could have occurred during delivery. Like stated before, the symptoms of cerebral palsy can change over time. Some of the most common symptoms are muscle tone, such as being too floppy or too stiff, exaggerated reflexes or spasticity, rigidity, lack of imbalance and muscle coordination, involuntary movements, and difficulty walking. Some more minor symptoms are drooling, slow movements, difficult eating, difficult learning, and difficulty with fine motor skills, and even seizures. So, in order to diagnose this disease, there's a couple of tests that can be conducted. First off, if the parents notice that there's a lack of motor development or skills while they're young, along with some of the previously mentioned symptoms, they should bring their child to a doctor for an official diagnosis. Some further tests may be conducted, such as an MRI. This allows for a detailed 3D model or cross-section of the brain where you can identify lesions or abnormalities in the brain. There's also cranial ultrasounds, which are usually performed during infancy but can provide a preliminary assessment of the brain. And then an EEG can be used if the person is suspected to have had seizures in the past and you're wanting to figure out the causes. Finally, there are lab tests that may be conducted to test for gene abnormalities or metabolic problems. And then once diagnosed, depending on further severity, further tests may be needed in order to assess general developments such as vision, hearing, speech, or movement.
Okay, so some treatments for cerebral palsy are treadmill training, and they have seen a lot of great results. Other possible treatments are known as biofeedback training, where electronic monitoring is used as someone is training, and they can use them to see them make movements and allow the person to become more aware of what movements they're actually making. So some of the potential benefits are the improvement of the motor patterns. There's a lot of benefit from the biofeedback treatment for ambulation. It increases their bone density. It increases cardiopulmonary endurance. It's an obesity prevention. There's also changes to psychological outcomes such as the cardiovascular fitness and to the bone density. So we looked at the treadmill and the treadmill walking and biofeedback, and we noticed that the biofeedback used the electronic instruments and EMG. The EMG biofeedback instruments were both, in our studies, were both connected to the lower limbs of these patients, and it could also just be connected to the affected side of the patients, and there were electronic and electromechanical instruments that measured the processing the feedback to the individuals from the auditory and visual feedback signals by using information about their normal and abnormal neuromuscular or autonomic activity. And when we looked at our studies that talked about the treadmill training, they used harnesses and hydraulic lifts a lot, and that helped the body weight be supported and they were able to reduce and increase walking speeds over the training period to make it easier on them so they wouldn't have all their weight and they were kind of like harnessed in so that if anything were to happen, they wouldn't be injured. These lifts were placed over the treadmill and it was called the Light Gate Walkable 100, and it made it easier for them to use the treadmill.
So, when looking through the articles for the treadmill training, on average they lasted for about 9 weeks, and the participants took part in this intervention for 2 to 3 times per week. They didn't specifically state for how long, but during these interventions they were supported by the harness as previously mentioned, and you can see in the picture. And the children who are better able to support themselves and have the strength to complete the walking, they did it completely on their own, while the people who were maybe a little bit weaker or were having difficulty understanding what to do, they took the first couple of days to show them how to make different movements, how the system worked, and for the first part of it, help them gather the movements and understand what they were supposed to feel like. So they were looking for an improvement of a 10-meter walking. They wanted to see better strength, endurance, and then just capability overall to make sure that they weren't needing to be supported by any equipment or just overall gains in strength. So when looking at the biofeedback, it was a similar idea where they were receiving treatment such as walking or physical therapy, but they were also receiving an EMG training for about 30 minutes a day for approximately 10 days. So this was just feedback so they knew how their movement was being made, whether it was efficient, just more outside information that they weren't able to gather on their own. And so even though the treatment itself was shorter, the supplement of PT or any other type of exercise was usually for 2 hours. So that was allowing them to be able to gain the strength, while the EMG was giving more information about their range of motion and how they were making the movement to improve in that way.
So some of the outcomes of the training, we noticed in treadmill training there were improvements in gross motor function, walking speed, and walking distance. This is measured in various ways through different functional assessments as well as tests like the 10-meter walk test, the 6-minute walk test, and for the treadmill training there was both the partial body weight supported treadmill training as well as the intensive locomotive treadmill training. We saw that the partial body weight supported treadmill training was not better than the control group, which was just overground walking. We did notice, however, there were greater improvements in the intensive treadmill training. For physical therapy, we noticed that there was reduced antagonist activities, an improvement in gait control and stability. The article that we looked at, it specifically looked at the triceps surae, which are the calf muscles. And so in cerebral palsy, normally there's stiffness, there's they use the part of the muscles, the triceps surae, during the early stance phase, which it causes them to use a lot of energy where energy shouldn't be used, pretty much. And so we saw reduced antagonist activity when physical therapy was given to them. And then we had EMG biofeedback, which showed improvements in range of motion as well as muscle tone of the ankle dorsiflexors. While this wasn't so much effective on its own, it was a highly effective treatment when it was coupled with physical therapy. Some of the key findings, so like I just said, the EMG biofeedback, it's more effective when coupled with physical therapy. We saw that when you just have one or the other, I mean, you do see improvements, but that would be just the most beneficial treatment. We saw that, for the most part, those treatments all transferred to gait-related activities. It was questionable whether or not the physical therapy, the biofeedback, It's questionable whether the biofeedback actually had transfer in gait-related activities. However, the other treatments did show that transfer. And then it was noticed that repetitive, concentrated practice may play a role in brain plasticity. So, walking for 30, 45 minutes, up to an hour, just that repetitive motion. And with the EMG feedback, the repetitive motion and having them think about what they're doing while they're doing it, that can lead to changes in the brain, both structurally and functionally. And then improvements in gait-related or gait-retained post-assessment. So after the therapy, some had 10-day follow-ups, some had month follow-ups, just depending on the study. There were improvements retained compared to their baseline. And then for the best practice, we kind of combine the best qualities of all the studies. So, as noted earlier, physical therapy, when combined with EMG biofeedback, is a very effective approach. The EMG biofeedback sessions would go on 30 minutes per session, and the physical therapy would last about 2 hours per session. And the sessions would go on 2 days a week for at least 8 weeks. As we noticed that, the longer the treatment, the longer the study, usually the more is retained by the participant. And then finally, the future considerations. First and foremost, more participants are needed to increase the statistical significance of the study. So a lot of the studies mainly had, just a handful, less than 20 participants, which that caused a lot of our data to, it turned out, we saw improvements, we saw decreases in stride time, increases in stride length, etc., but they weren't statistically significant because we had such few participants. Additionally, neuroradiological studies are needed to investigate functional brain changes. So this can be achieved through, functional MRI, and the goal of that would be to kind of see what areas of the brain are being affected, whether these changes, these therapies are causing actual changes in the brain, whether they be functional, which we would see on the fMRI, or structural, which we would just see on regular MRI. We also need studies that are longer and more intensive, that make these significant physiological changes. Like I said earlier, I think the longest study was only 9 weeks long. A lot of them were only 4 weeks. One was a 10-day trial, and we didn't see as much of the effects as we did with the longer trial, and as well as the retention was more significant in the longer trial. And having more intensive trials, that's going to make it more rigorous for the patient. It's important to keep in mind that you don't want to make it too rigorous or too difficult for the patient, as that can lead to injuries. It can lead to the participant not wanting to continue, discomfort, stuff like that. So it's important to keep it intensive, but at the same time, making sure that you're taking into account the participant's level of ability. And then finally, at-home treadmill training for feasibility and cost effectiveness. So there's one study that said there is a portable treadmill device for at-home use. The problem was mainly cost. But then with a lot of other studies, there's the whole, having to go to the clinic, having to take time out of your day multiple times a week to do these exercises, do these interventions, and to be able to do it at home for cheap costs and relatively low time commitment. This can be a much more widely used and beneficial therapeutic approach for cerebral palsy.
Thank you for listening to our presentation.